Okay, treating breast cancer might be overwhelming, but acupuncture promotes better healing. Good afternoon, honorable judges. I'm Vindasya from Faculty of Medicine, University of Indonesia, and I represent my team with the title Efficacy of Acupuncture, Electroacupuncture, and Auricular Acupressure to Improve Sleep Quality on Breast Cancer Patients, a systematic review and a meta-analysis study. So, insomnia may seem normal to many, but in breast cancer, it can be a cause for concern. According to a recent study, 20 until 70% breast cancer patients are reported to experience insomnia or sleep disturbance, which is confirmed as a lasting symptom in breast cancer patients. This symptom is reported to be aggravated by chemotherapy, considered as the common standard therapies. Insomnia is also reported to be triggered by the somatic cognitive cortical hyperarousal effect, which leads to the physiological distress, prolonged fatigue, and also if it left untreated, it can impair physical restoration, less effectivity of medications, and also indirectly causing the increase of the mortality rate. And conventional therapy, such as sleep medications and CBT, show less significant effect to treat sleep disturbance. This issue demands clinicians to explore more effective intervention. Then we found acupuncture, electroacupuncture, and auricular acupressure, which shows the promising result, but it still lacks comprehensive quantitative analysis to evaluate their efficacy on sleep quality. So this study would focus on assessing their efficacy and rank them based on the pooled effect size. So we move on to the method. We carried out frequentist network meta-analysis of randomized control trial. We used the Prisma flowchart to visually provide the article screening process, and we are also conducting literature research based on the reliable databases such as PubMed, Scopus, Cochrane, and ProQuest. And we used the bias assessment tool, ROB 2.0, and we performing data analysis using the RStudio and Revman 5.4 to give the supporting data. And this is the detailed keyword in all databases provided. And this is the eligibility study, which we conclude in the inclusion criteria and exclusion criteria mentioned in this page. And we are also mentioning the indicator for data extraction, including the main outcome and also secondary outcome. And this is detailed explanation we use on our OB assessment, all the indicators we use to perform risk of bias assessment. And this is the data analysis step, the detailed step that we performing in data analysis. And finally, we choose systematic review and network meta-analysis study for these following reasons. And lastly, we use the main outcome, PSQI, and also secondary outcome relating to fatigue and psychological distress, which the acronym is mentioned below. And lastly, we move on to the result. Our studies included 10 randomized controlled trials spanning over 1,020 patients and spanning from the 6 countries. This is the result of risk of bias assessment that indicating low to moderate risk of bias. We move on to the results for the network meta-analysis. Figure 3 shows network plot for intervention compared to control group and also the standard therapy. And the figure 4 are performing the statistical analysis, which we give in a forest plot. All interventions were found to show significant improvement of sleep quality from PSQI score. And acupressure was the best, reducing PSQI score by minus 2.69. And the figure 5 shows our league table. Significant result was found for the acupressure to chemotherapy, aligned with the forest plot result. This is our Supra score. And this is the meta-analysis, the additional data that we performed to measure the magnitude of the PSQI score, and also we providing the supporting data, the BFI score, to measure the fatigue level, and also to measure the psychological distress, we use the HADS score. And this is our funnel plot. We assessing publication bias. All the interventions, all the outcome, the PSQI and BFI are reporting high publication bias but low in HADS. And this is how we implement all intervention. Basically, acupuncture performed by inserting needle to acupoint throughout our body. Electroacupuncture basically also using the same technique, but it promotes the electrical stimulation, which in fact the neural pathway on acupoint. And auricular acupressure is just giving the pressure to the ear, which they're getting acupoint on ear, and they promote non-invasive technique. This is our advantages. All the interventions showing the significant sleep quality. And also the acupuncture promotes the higher cessation rate of sleep medication than sham control and promotes minimal side effects. And electroacupuncture are showing the enhancement in electrical stimulation, which raise effectivity to treat nerve-related pain. And the auricular acupressure are promoting the auricular site considered as an effective target, balancing hyperactivity of sympathetic nerve. And the availability is all interventions are shows few side effects, immediate relief, minimal risk of infection and complication. And the most important thing is showing the safe time and cost efficient, which the procedure can be offered in a group setting. And this is the strength of our study. We highlighted we are the first network meta-analysis to report and rank efficacy of the mentioned intervention in sleep quality. And we also provide complementary analysis in other frequent symptoms, just as fatigue and stress, which reminded us having strong correlation to create insomnia. And unfortunately, we are having the limitation, which showing the high publication bias. It might be due to the fact that we include multiple interventions to compare, and each intervention may have different effects on the patients, and limited studies assessing efficacy of auricular approach in acupuncture and electroacupuncture, which might be having different baseline state with the acupressure, and unclear method to record sleep quality. And this is our conclusion. All of the evidence is statistically significant except the auricular acupoint, the effectiveness of auricular acupoint, which allegedly has neural microsystem related to all organs. They are reported as the central of the acupoint. And lastly, our recommendations is to conduct more study assessing efficacy of auricular site in all types of acupuncture and its effectiveness as a notable approach. Additionally, providing a clear method on recording sleep quality as guidance for patients in all study is considered important to lowering the risk of bias. And this is the reference of our study. Thank you for your attention, and I'm open for the questions. Thank you.
Thank you very much for another outstanding presentation. Does anyone need further clarification?
Thank you for your presentation. I really like your slide. It's quite informative. Could you please tell us more about the mechanism? I mean, it's quite interesting why acupuncture improve the sleep qualities. Could you please explain more about the idea?
Okay. Thank you for your question, judges. I will try to answer. So how the acupuncture improve the sleep quality is they are stimulate or attracting the acupoint. That acupoint is targeted and projected in all the body, all the body of human, and they are also gives us the complex interplay between there is a fatigue and also pain, or might be they are having the arousal effects, hyperactive arousal effects that causing the disturbance or the the disturbance in a circadian rhythm, which after that it could causing insomnia.
So thank you for interesting presentations. So acupuncture, acupressure is very familiar in the East Asia, right? So for the searching, do you searching only for the English publications or any Chinese translation to English? Because it's difficult to use. Okay, go ahead. Yeah.
Okay. After that, we mentioned it in our eligibility study. We are just included the English study because all the reliable databases showing the almost all the English study rather than other languages. So we just included the English study, and we are also reporting from the various nations, with including also the nations from the East Asia and around Asia.
I do agree with you because it's difficult to searching in Chinese, right? Even though this procedure is very familiar in Chinese or Taiwan, but you have a few study from that area of Asian, so I appreciate that.
why
Okay, thank you.
your comparator is chemotherapy. Do you interested in this intervention or not? I saw you from your forest plot for the direct meta-analysis and network meta-analysis that one type of your intervention is chemotherapy.
Yes. Okay, for this standard therapy, we are using the chemotherapy, which almost all studies are using the control group is the chemotherapy, because the chemotherapy is a common standard therapy, and it's also becoming the first line of therapy and treating breast cancer. So we performing the network meta-analysis to give the pooled effect size, the multiple studies that using that interventions, that three main intervention, and we are also performing subgroup analysis to give the all the studies magnitude. Like, when we are using just meta-analysis, it's all from all the from all the studies mentioned, it's giving their own magnitude of score individually. So we just want to give the better understanding regarding those score in the subgroup analysis.
Yes, but you're interested in the breast cancer patient who have insomnia, right? And chemotherapy is
Yes.
standard treatment for the breast cancer, not insomnia. So I suppose
yes.
I suppose that for the study, both group also receive chemotherapy, right? That is the standard treatment for the breast cancer. But for treating the problem of insomnia,
Yes.
maybe they compare with placebo or no intervention, right? Not compare with the
Okay.
chemotherapy.
Okay.
Does any judges have any comments? Thank you very much.